This is Dr. McGinley. Welcome to the first week of Nursing 174. Although we often refer to the class as OB, you will also learn about gynecology, normal and abnormal, as you proceed through this course. How do you go about preparing for N174 each week? Well, you have to come to class prepared to participate actively. The content from the textbook and the video lectures will be on quizzes and exams, as well as the variety of learning activities that you will be participating in during the class time. You have your choice of reading the book or watching and listening to the video lectures, or you can do both. Select whichever method works best for you. Yes, the video lectures will take up some time, but for those of you who like to listen and write, this may be the best method for you. After you read or watch the video lectures, you have to take the video self-assessments that are posted under the weekly lecture video tab on Blackboard. The assessments test your comprehension and ability to apply the information you learn from either the textbook or the video lectures. Your professors will guide your learning each week, but we will not be lecturing in the classroom. For week 1, what are we going to focus on? You will learn about conception, early pregnancy physiology and the physical changes that occur in a woman's body, fetal development, prenatal care, common complaints in early pregnancy that are normal, and complications that occur in early pregnancy such as fetal loss, excessive vomiting, and abnormal fetal development. In case you have forgotten the physiologic changes that occur with the menstrual cycle and conception, there are several video lectures you can watch by the Khan Academy to refresh your memory. Then you're going to switch gears to learn about health maintenance during the reproductive years. Later in the course, you will learn about other GYN disorders, so this is the introduction of how we try and keep women healthy. When you focus on your studies, you want to think about what should the nurse teach the patient? What should the nurse be on alert for? How do I interpret the information that I have in front of me and make it usable to help the patient? What should the nurse anticipate in terms of management and follow-up care? Keep in mind that the information given to you on the preclinical documents are also threaded throughout the course and will be used in theory as well as clinical. Condense your notes so that they make sense to you when it comes time to study for the midterm and the final, and to prepare for lecture. Answer the learning objectives each week and focus on these topics. Hormonal support of pregnancy, the diagnostic testing in pregnancy. What do we do? How do we interpret it? How do we relay the information to the patient? What are the signs, symptoms, and management of the first trimester of pregnancy? What do you need to tell a patient when you're counseling them about the do's and don'ts? What structures form during fetal development? And then there's so much in the health maintenance. What are the recommendations for pap smears, mammograms, menstrual disorders, risk assessment, and what do you do with the information? Answer the learning objectives each week. Focus on the topics listed here. Similar to clinical, you should be able to answer the focus questions that have been on your clinical write-ups. We hope you enjoy women's health nursing, and thanks for listening.